A very good afternoon, everyone, and welcome to today's session of Ask the Expert. We've got a fabulous guest, as well as our topic is so important for all women, wherever and in whichever age they're in. This is a topic that you really want to listen to. Menopause. And it has different stages, different symptoms. We all go through it, and we need to know what to do and how it affects our mental health. Today, it is my privilege to actually have Dr. Louisa Albertine. She is a general practitioner with a special interest in sexual health, and she is based in Johannesburg with her own practice as a GP, as well as she works in a licensed My Sexual Health practice also in Johannesburg. She graduated in 2018 from the University of Free State and started doing extra training in the field of sexual health through the My Sexual Health program. And she did her ComServe during that year as well. So, welcome, Dr. Louisa, to our session.
Hello, everybody, and thank you so much for having me. It's always a privilege.
Wonderful. So, we're going to get right into it. What is actually menopause? And there are different stages about menopause. If you could just explain that to us.
Yes, so basically, menopause, the definition is 1 year with no period. So each woman is born with a certain amount of eggs, and as you're in your reproductive years, every month you ovulate, you have your period. Then, when your eggs are finished, you will reach menopause. 1 year with no period is exactly what menopause is. When we speak about perimenopause, it is that transitional phase where it can be anything between 4 to 10 years before menopause. So already 10 years
Really?
before going into that having no period anymore, having had your last period, you can already be in perimenopause. And if you are in your 30s and you reach menopause that early, we call it premature ovarian insufficiency. Yeah, basically, that is the simple definition of what perimenopause and menopause is. And as we will chat today, it's not just about the ovulation, but the hormones that fluctuate during perimenopause. And then in menopause, your ovaries stop making hormones because they're not, I can say, used anymore to ovulate. So during perimenopause, those hormones are all over the place, estrogen up, down, progesterone declines. But in menopause, they are just flatlined and you don't really have much of them left anymore.
Wow. And that is why we often hear about, people, women experiencing hot flushes, changes in their period cycle, and sometimes they may manifest with anxiety or irritability or a low mood. Can these also be linked to the changing hormones?
Definitely. So every menopause symptom that we know of, the hot flashes, the anxiety, struggling to sleep, mood changes, weight gain, the list goes on, can already happen in perimenopause. But there you still have periods. They change in the sense of they can become irregular. Sometimes before they become irregular, they are just heavier or longer or lighter and shorter. So your period actually changes as well. But all those symptoms that we typically know as the menopause symptoms can already start during the perimenopause phase.
Okay, does sound quite complicated because, like you said, it could vary in the length and duration of that perimenopause stage. Are there any other symptoms that we should be looking out for?
So the biggest symptoms, I always like to group them as what the low estrogen causes and what the low progesterone causes. So the fluctuation and then eventual drop of estrogen is the reason for most of the symptoms. So that is your hot flashes, mood changes, which is a big thing we'll talk about today, weight gain, brain fog, night sweats, The stuff that you don't feel, but that you later can struggle with, is osteoporosis, so the density of the bones. Also, estrogen is cardioprotective and protecting the brain. So estrogen actually is the big hormone. But let's not forget progesterone. The decline in progesterone causes most commonly the insomnia and anxiety. And then the last hormone we forget about, or let me say the research is only featuring lately, is testosterone. So women also have a little bit of testosterone, and testosterone comes in when there's sexual dysfunction. So low libido or hypoactive desire disorder, also where women start struggling with orgasms, with arousal, and let's not forget vaginal dryness, which is again the estrogen that drops. So then sexual intercourse can become unpleasant and painful because that lining thin, I always say it's like as your skin thins and you lose collagen and estrogen in your skin as you get older, the same happens to the vaginal mucosa. So there's the sexual dysfunction that also comes. And I think that's the big symptoms, but there are less common things like tinnitus, and some women complain of a metal taste in their mouths and itchy skin. Um, those are not that common, but if I forgot any of the big symptoms, you're welcome to add, Anne.
Well, I'm just so much in awe of all these different symptoms that go with the hormonal changes, and from estrogen to progesterone as well as testosterone. It's so interesting how they regulate the body and the different, signs that accompany it. And I'm sure co-occurring with this is, like you said, symptoms of depression and anxiety. So when someone says, I'm feeling very overwhelmed, and how should we interrogate more to find out if it is due to maybe menopause or the perimenopause stage? How should we navigate that conversation?
I always think of it as when you see a woman as a patient or a friend, or whether you're a psychologist or the work that you guys do or a medical doctor, never forget women have hormones. And we have fluctuating hormones, and later on, no hormones. So it's so easy with men that, they have testosterone. It can decline as they get older, but it's a slow, steady thing that happens. In women, every month is up and down in any ways, and then later on, it's just more all over the place, and later on, there's nothing. So whether we have hormones or not, please remember we are hormonal beings. And if you
We
think,
just big woman.
um, yeah, if you if you work with a woman, the thing is, listen to her. If she says nothing really happened, but I'm not feeling myself, hormones is the first thing that should come to mind. And it is not easy as healthcare providers. If someone's in their 30s, you're not maybe gonna, the first thing that comes to mind is not always hormones. It is not that common to go into perimenopause or menopause in that age group, but it isn't impossible. So always just think hormones. There's always hormones involved. And as you sit with someone and you discuss, when did your symptoms start? Is there any triggers that made you anxious or made you feel depressed? Do you have a genetic predisposition to depression and anxiety? Were you always an anxious person, or is it a new thing? How's your sleep? Ask a bit about the other symptoms as well. You can often, with just getting a good history and chatting about when did these things start, that will guide you as to think, let's maybe check this lady's hormones, or no, she's just going through a difficult stage. She's predisposed to depression or anxiety, or she's always been an anxious person. Then perimenopause and menopause doesn't, it's not the first in line for the diagnosis. But just
Mm.
sitting and looking at the timeline, and if there's any triggers, it will guide you as to whether you should think this is hormonal or purely hormonal, or no, this is a depression or anxiety disorder.
Yeah, no, that is very beneficial to know. And from what you have just shared about the hormones, what sort of treatments are available for women that are actually going through either perimenopause or the menopause stage? So, because I know there's a lot of information about hormonal therapy or hormonal replacement therapy, but please share with us what are these treatments?
On the topic of so much information, I've literally had ladies come and see me they're in perimenopause, but they're feeling okay. But the information is so overwhelming that they think they should be on some form of hormonal replacement therapy. So, to put it simple, during perimenopause, you still make your own hormones. As I say, they're a bit all over the place. So the aim there of medical treatment, if you think hormonal treatment, is either to stabilize those hormones with a low dose contraceptive pill, or we use hormonal replacement therapy in the form of, we say, sequential. In other words, we still let you have your period every month. So we give 2 weeks of
Mm,
progesterone, 2 weeks of no progesterone, until you have that year of no period. So if I see in the bloods, she's still making actually a good amount of hormones, they are just all over the place, then I like to do something like a low dose contraceptive pill that just stabilizes those hormones so that your ovaries can stop firing hormones on and off. Then, when you
mm,
are in full menopause, so 1 year with no period, and by the way, then anything after that is post menopause. We didn't speak about that, but then for the rest of your life, you're post menopausal. Then you give hormone replacement therapy. So you give that woman estrogen and progesterone. So you basically give them what they've always had. Obviously, there's many options. There's patches, there's gels, there's tablets. So I'm not going to go into that, but with the consultation with your medical doctor, you'll sit and you'll discuss if you're fit for HRT. If you've had something like breast cancer, then you can't have HRT. If you have had a blood clot, for example, or you smoke, then we stay away from the oral hormone replacement. Then we rather do it through the skin, so your gel or your patch. So not to go into detail there, but hormone replacement therapy is the mainstay. Then there is off-label stuff as well. In other words, like if someone is really depressed or anxious, you can use an antidepressant like an SSRI. Some of them have actually been proven to help with hot flashes as well. So you sort of treat the anxiety, depression, but it can actually help with your hot flashes as well. With all the data we have now about the safety of hormonal replacement therapy, that will always be your first line of treatment because it protects the bones, the brain, cardiovascular health. So even a woman that goes in menopause with absolute no symptoms, full menopause, no period for a year, I will advise HRT because it protects your bones, your brain, your cardiovascular health. So even if you feel okay, there are women that's fine, they're lucky, no hot flash ever in their lives. I'm for hormone replacement therapy. So then you can. We also have a registered testosterone cream on the market now. So for that hyperactive sexual desire disorder, you can prescribe testosterone. There's vaginal estrogens that's very safe that can help that vaginal lining that it's not dry during intercourse. And then there's natural medication that also have some data on it. But if a woman is, cleared, she can have HRT. I'll always prescribe HRT.
okay. No, there's so many different options, and obviously, consultation with the medical practitioner is key. And I think the interventions that you want to hear of, like you said, there's so much of information on Google, but there could be side effects, there could be other situations you need to consider. So consult with your practitioner. But apart from medical treatment, if the person is manifesting with depression or anxiety because of the symptoms they are experiencing, what sort of practical things would you suggest for them to do?
I think we should never ever forget a healthy lifestyle and the benefits of it. So, stuff like exercise, your eating healthy, so feeding your body the right stuff. So
Yeah.
important, especially weight training, postmenopausal and during perimenopause to build those muscles, not only good for the brain and give us the feel-good hormones, but it's good for the body. And I really think it's important to have a safe space to go to. So a practitioner that you can walk the journey with. There's no one size fit all with HRT. So sometimes you have to try 5 different ones before you find what works for you. And then a good support system. So with your friends, have, good communication with your partner or your husband, with your children, so that there's understanding. Educate yourself because that empowers you and educate those around you. I think, especially in the workplace, it's also very important that, and luckily, I feel there is a move towards that with the more education we have, that men try and understand these things. They're never going to go through it, but that there is support at your workplace for menopause and just understanding and educating is so, so important. Lifestyle, that is the big answer to your question.
Wonderful. Lifestyle changes can impact behavior, it can impact even your relationships. And I think also what we have found, even in the mental health field, is that there's a lot of stigma. So, how would you encourage people to deal with the stigma of feeling maybe ashamed or embarrassed because they're having longer periods or heavier flows? What would you suggest they do?
Again, I think it all comes back to education, that you do not have to be shy or ashamed going through this. I'm thankful that there's so much information about menopause out there lately. It is overwhelming in the same sense, but there is really nothing to be shy about. I think having at least one woman in the workplace that you can go to is that safe space that you can say, listen, I'm not okay, is so important. And reaching for help, there is help. Really, you do not have to just go through this. I think 20 years ago, it was just, this is what happens to every woman. I just have to go through it, push through it. There is help. So reach out for help.
And reaching out for help is actually quite a brave thing to do. And I see we've got some audience questions as well. The first one says, I'm 42 years old and lately I haven't been feeling like myself. I've become more anxious, emotional, and I get easily irritated. Could it be perimenopause that's affecting my mental health?
It can definitely be perimenopause. If we think of, menopause, the mean age is about 52, around there. So 42 is exactly that 10 years before menopause. It's also interesting that it's important to actually ask your mom when she went into menopause, because it's often the same age that the daughter will go in. So if mom was maybe 48 when she went into menopause, then yes, it can definitely be perimenopause.
Okay. And I know you did speak about the predisposition, so I know it's difficult conversations, but yes, it's good to know what happens even in your family lineage so that you can be prepared as well. I see we have another question, and here it goes. I've never really struggled with anxiety before, but since entering menopause, I feel anxious and low for no clear reason. Should I just accept this as being a normal part of menopause, or should I consult a doctor?
Look, I think that yes, it is part of menopause. I think that we should not see menopause and perimenopause as a disease, but there is help. So, if, I mean, it's inevitable. All women are going to go through it, not the same way and not the same symptoms necessarily, but you're going to go through it. But there is help. So, if that anxiety impacts your quality of life, then yes, you should see a medical doctor for help.
Yeah. I think functionality as well as the frequency of how low or how sad or how many times your mood fluctuates and how it's affecting you is very important. That's when you should actually seek help. And then we have another question. My sleep patterns have become terrible. I'm constantly tired. I feel overwhelmed by things that never used to bother me before. Could this be connected to perimenopause?
It can definitely be connected to perimenopause. So, progesterone is actually the first hormone that declines, and it's low progesterone, as I said earlier, that leads to the insomnia and anxiety. You just wake up feeling anxious for no reason. So, quality of sleep, it can definitely be affected by it, especially if, as you say, just suddenly out of the blue it's happening. There's nothing else that triggered it. So yes, it can be linked to that.
So, with the hormone replacement therapy, if they choose to go on it, how long should they be on it? Because I know you mentioned post-menopause stage as well.
Yes. So look, we according to the old guidelines, it was always 5 years, then you need to stop. But first thing with treatment is start within 10 years of the onset of menopause. So your benefit is please start within 10 years. It doesn't help you 20 years postmenopausal and then you start on HRT. That won't benefit you. But the newest guidelines say that you can stay on it as long as you need it. So let's say you do 5 years, you at least want the benefit for your brain, your bones, and all that, but you stop the HRT and the symptoms come back, you're allowed to stay on it.
Mm.
Again, just discuss with your medical provider that above 60, for example, we rather stay clear from the oral HRT, but rather go to patches or gels just for the risk of blood clotting. So there might be some changes in your HRT. We might drop the dose, but if your symptoms come back when you stop your HRT, you're allowed to be on it as long as you need it. But we might
Okay.
drop the
And would you encourage them to use supplementary dosages of maybe vitamins or minerals to augment that?
Yeah, it can definitely be beneficial. I think there it's important that you also look holistically at someone if they, for example, have other comorbidities like high blood pressure, high cholesterol, all those things. Then there's certain things like omega-3 that you can supplement with. So yes, I'm not against any supplements, but again, I say that, nothing is going to take the place of hormones in the end.
Wow, what an interesting topic because with the different stages of menopause, as women, we, like you say, we often say that we are in control of it, we can manage this, but sometimes it just gets us down. And if you feel like at any point that the mental health is lagging, do make sure that you reach out for help because help is out there. You can even contact us. And we are really grateful to you, Dr. Louisa Albertine, for actually spending time with us today, for sharing your knowledge, and for helping us to better understand the different stages from perimenopause, which could vary in length and duration to when the actual menopause, that means a whole year that you haven't had a period, and then the post-menopause period, which happens after you've reached menopause, and how this impacts on a person, whether it's mental health changes, physical changes, or even changes in your social connections as well. So just remember, everybody, that this session has been recorded and will be posted on our YouTube channel. And you can access it whenever you want to. And if today's conversation resonated with you, remember that you don't have to struggle on your own. SADC offers a range of free mental health support groups for people facing different mental health challenges and or life experiences. To find a support group that's right for you, please visit our website, which is www.sadeg.org, or call the SADC Mental Health Helpline, which you can use by dialing 0800 21 22 23, where a counselor can guide you to the right support that you would need. Just remember, like we said, all of these sessions are recorded. You can access them at any time via the YouTube channels. And thank you so much for joining us today. And Dr. Louisa, thank you. You have a splendid day, and we will see all of our visitors and followers next Friday with another brilliant topic. So take care and all the best for the weekend. Bye.